So hello friends, in this video, let us see about the tuberculin skin test, also known as the Montauk's test. So let us see how this test is performed and how the result is interpreted. See, this is the tuberculin PPD, 2 tubercular units per 0.1 ml for Montauk's test, and this is the, you can see this is the tuberculin syringe, and here are the markings from 0.1 ml, 0.2 ml, and as you know that 0.1 ml contains 2 tubercular units, so we have taken 0.1. And if you have to give 1 tubercular unit, then we have to give 0.05 ml, that means half of 0.1 ml. So this is the tuberculin syringe, you can see. Hello friends, let us quickly see about the tuberculin skin test, also known as the Montauk's test. So it is the simple, reliable and common diagnostic aid for tubercular infection. So basically it detects the presence of delayed type hypersensitivity, that is a type 4, against tuberculosis, an indirect indicator of prior natural infection or BCG vaccination. So let us see what is the principle behind this tuberculin skin test. The initial infection of an individual with Mycobacterium TB or infection with other atypical mycobacteria or BCG vaccination leads to proliferation and sensitization of T cells in the regional lymph nodes. And after intradermal administration of tuberculin PPD, that is the plasma protein derivative, results in re-stimulation of sensitized T cells and produces delayed type hypersensitivity reaction. The earliest response includes vasodilatation, edema, fibrin deposition and collection of other inflammatory cells at the site of injection, and forms induration of varying size and intensity, and this induration diameter is directly proportional to the intensity of the degree of sensitization. In most cases, hypersensitivity is due to active or latent infection with members of MTB complex or BCG vaccination. And let us see the storage of this tuberculin PPD. It is stable at +2 to +8 degrees Celsius and do not freeze the vaccine. The exposure to light and freezing will result in loss of potency of tuberculin, and it should be kept in dark. To the important part, procedure. So how this Montauk's test is performed. So basically we have to give intradermal injection in the middle third of forearm, and the preferred site is flexor or dorsal surface of forearm about 4 inches below the elbow joint. You have to clean the area with 70% alcohol, and we have to avoid the area which is red, swollen and areas with visible veins underneath. So the skin is slightly stretched and needle point is held almost parallel with skin surface, and it is inserted into the superficial layer of the dermis. As you know that it is given intradermally, and this needle should be visible through epidermis during injection, and solution is slowly injected, and a small papule of 8 to 10 mm diameter appears and remains for about 10 minutes. If papule does not appear, then solution has been injected too deeply. That means it is not intradermal, it has gone deep. If same arm is used, the injection site should be separated at least 5 cm from first site of first injection site. Now how to interpret the results. The tuberculin skin test should be read after 48 to 72 hours after tuberculin PPD injection. Result should be read in good light, and only induration should be considered and not the surrounding erythema. This is very important. The diameter of induration is measured in mm transversely along the axis of forearm with transparent flexible ruler. The positive result may be due to latent infection, early infection or active disease due to Mycobacterium tuberculosis complex, atypical mycobacterium or person with previous BCG vaccination. Generally, an induration of more than or equal to 10 mm is considered as positive, whereas more than 5 mm in HIV infected is considered as positive. So let us see the size, report and interpretation. If it is the induration is less than 5 mm, then the report will be negative and interpretation is no infection. If it is between 5 to 9 mm, that is more than 5 mm, which is the report is borderline, and interpretation is because of BCG immunization or natural infection in immunocompromised. If it is 10 to 14 mm, that is more than 10 mm, then the result will be considered positive, and it indicates the previous natural infection, not necessarily disease. And more than 55 mm is strongly positive, strong possibility of disease. And there are some diagnostic errors in tuberculin test. It can be false negative and falsely positive. So it is falsely negative in cases such as severe diseases such as miliary disease, meningitis, also in severe malnutrition, and also in immunocompromised states such as HIV, prolonged steroid therapy, and also the technical errors such as inactive tuberculin, subcutaneous injection, etc. So this tuberculin test will be falsely negative in such cases. Also recent infection, because tuberculin test conversion takes 2 to 3 months after infection, that is time required to develop the delayed type hypersensitivity. And the false positive is rare in case of tuberculin skin test, but it can be in case of higher PPD strength for testing. If used, then it can lead to false positive result. Also secondary infection at the site and non-tubercular mycobacterial infections such as atypical mycobacteria or leprosy can lead to false positive results. And this is very important to know that 1 tubercular unit of PPD RT23 is equal to 5 tubercular units of PPDS. And the use of tuberculin strains of 1 tubercular unit is recommended for standard Montox test in India. This is very important. 1 tuberculin test is recommended. Since the non-specific sensitivity, that is sensitivity due to atypical mycobacteria, is high in our country, 1 tubercular unit is better in separating infected individuals with disease from without disease. And therefore the shift to tubercular units is not recommended in our country. For diagnostic purpose, we should continue to use 1 tubercular unit of PPD RT23. So this was all about the Montox skin test. So hope you have benefited with this video. Thanks for watching.